Professor Forget, please be followed by Professor Zhao.
Thank you for inviting me to speak to you today. This bill that we're considering today specifically addresses adults of working age, that is, people between 18 and 64. This is a really challenging group to talk about, and many people wonder whether it might not be better to introduce good job training programs and labor market policies that lead to better wages and working conditions than to take a chance on a basic income that might discourage people from working. We know that the best empirical evidence out there suggests that a well-designed basic income will not substantially reduce the number of hours worked. Some people have argued that it will increase the hours worked or move people into better jobs. We've just seen that the PBO estimated a reduction in the number of hours worked of only 1.5% at most. However, what I'd like to argue is that we need both better labor market policies and a basic income. Not everyone can work at a regular job that pays enough to allow them to live above the poverty line. Some people have disabilities and receive disability support, but many people with disabilities don't qualify for such support, particularly those with recurring disabilities, or including especially mental health conditions. Other people simply don't have the job skills that would pay a living wage. Some of those people can be retrained, but clearly not all. Sometimes there are no jobs to be had because the Bank of Canada has taken particular policies, or there's no transportation to the jobs that do exist. Other people have personal responsibilities and limitations that make regular paid employment impossible. Some people have lived with such devastating personal and generational trauma that they have to do a great deal of work on themselves before they're ready to work for anyone else. I was at an event on October 4th at the Canadian Museum for Human Rights on behalf of missing and murdered Indigenous women that reminded me once again of how many Canadians have lived on incomes between $6,000 and $10,000 a year for most of their lives. Few people who've lived on the streets for any stretch of time can expect to take a short job training course and become employable at a job that pays a living wage. So you look at that kind of evidence and you wonder whether what we actually need are social programs designed to address the very special needs of marginalized groups instead of a basic income. And again, the answer to that is that we need both specific social programs and we need a basic income. We need treatment for people who use substances. We need harm reduction policies, mental health services. We need all kinds of supports. But it's really hard for people to take advantage of these policies when they don't have a full belly and a roof over their heads, shelter from the cold. I live in Winnipeg, which has the largest Indigenous population of any city in Canada. Many of the absolutely essential social programs we have in place struggle a lot to be perceived as something other than colonial overreach. There isn't a lot of trust among the population, and coercing people into a job training program or addiction treatment programs in order to meet their most basic needs is both ineffective and demeaning. The stability that a basic income introduces into people's lives allows them to take advantage of these social programs on their own terms, to move forward, to benefit their own lives. Now, I think many people recognize that a basic income might be a beneficial policy, but they wonder if we can afford it. They wonder if this is the right time to be talking about a basic income. Years ago, I looked at the Mincome Project, which took place in Manitoba in the mid-1970s. That project ended in 1978 as it was planned. The results were very positive. The researchers wanted to continue the project. But instead, they were told to archive the data because times were tough. At the end of the 80s, we were looking at high interest rates. We were looking at high inflation rates. It just wasn't the right time. A few years later, the MacDonald Commission, which reported in 1984, recommended a guaranteed income. We got NAFTA, but the guaranteed income got sidelined because, again, 1984, times were tough. It wasn't the right time to talk about a guaranteed income. I'd just like to end by suggesting that times are always tough. The economy is always in crisis, or it's about to fall into crisis, or it's just emerging from a crisis. We have an opportunity to look beyond the immediate future, to make plans over a long period of time that can transform people's lives, transform the kind of society we live in. And I think we have to remember especially that hard times are always hardest for those who have the least. We need a basic income, and I would urge you to look at this bill carefully and to talk to people, talk to a wide range of people who can help to bring together a good project design for a basic income that can make a real difference in the kind of society we live in. Thank you.
Is there a fear that once you provide additional financial assistance, that they could lose other benefits? And I'm thinking of things like a drug card. Once you get to a certain income level, you would lose your drug card, which is very, very important to people receiving financial assistance. So could you talk about that aspect of the incentive not to work? Can you just address that concern?
Professor Forget, comment? Professor Zhao also?
Yeah, I'll just echo that if I can. I think that no one sees a basic income as a program that's just pasted on top of all of the other programs. The existing programs already have a lot of contradictions built into them. And so what basic income does is it gives us an opportunity to clean out a lot of those programs and to make sure that they work together.
Thank you very much for being with us this morning, witnesses. To Madame Forget. 10% of Canadians or so don't file for income tax. The people who are in the most fragile, the most vulnerable in society certainly don't. In that light, given the CERB that was made available to the public, what are the advantages of a guaranteed basic income?
I would say first that basic income does not need to be delivered through the tax system. That's one option, but there are other ways of delivering a basic income. For example, if there were a cooperation between the provinces and the federal government, there's a lot of machinery at the provincial level that can be drawn on to deliver a basic income. So this is part of the design of a project. How do we do that? In terms of tax filing, I think that a lot of people don't file tax returns because it's not worth their while to file tax returns. Now, it's true that many very marginalized people don't get the benefits that they should be getting because they don't file tax returns. But I think that there are a lot of efforts put into place right across the country to increase that. For example, there was a political decision on a lot of reserves not to become involved in the tax system for all kinds of reasons. When the Canada Child Benefit was substantially increased in 2016, a lot of effort was made to ensure that people received the Canada Child Benefit, which was delivered through the tax system. And that was done both through a concerted effort to make sure that the people who should be filing are filing, to make sure that that information was available. But CRA also developed a simple one-page attestation of income. I can't remember the number offhand, but it became very, very convenient and very possible for people to file income taxes under those circumstances. So I think we have to look a whole lot at how we can improve that system if we're going to use the tax system to deliver benefits. I think that can be part and parcel of designing a basic income and asking ourselves how best to get it into people's hands.
Madame Forget, I'm just wondering if you, as you look at this, and there's so many individuals who are trying to do good things in this program or potential program, I guess a simple question that sort of strikes me is, how do you mobilize people from all the different parts or geographic places in our country who are really concerned and have some fantastic ideas in their mind? How do you mobilize this group to set up? And I know that Senator Pate's doing this with the bill, but how do you mobilize that population out there of people who are leaders who are going to say, hey, let's get this thing organized properly so that people can't say no to us?
That is probably the hardest question you could ask me. I think that one of the real limitations of the system we have is that there are literally hundreds of programs across the country.
Right.
Some of them are simple cash transfers, some of them are combinations of services and transfers, some are services. They're all run by people in their own little silo, in a sense, and everybody thinks that they've got the answer to whatever it is we're doing. I think that one of the things that is becoming more commonly recognized across the system is that these problems are all interrelated. If we're trying to deal with the issue of missing and murdered Indigenous women, we can't do it without looking at a whole range of other issues that impact on people's lives. If we're looking at issues of addiction, of substance use, we can't do it without looking at poverty, at homelessness, and at all of the things that go along with it. And I think that one of the things that we see at its core is that poverty actually requires money. You actually have to get money into people's hands so that they can make decisions. And it really does simplify, in some ways, the possibility of those people who fall between the gaps in the programs, those people who aren't compliant, those people who don't fit into the programs that are set up. What cash does is it allows them to make their own decisions and come to the programs and make use of them the way that they can. So I think that a basic income is foundational. How we get to that, I think we are moving towards it, but the progress is a whole lot slower than I'd like to see.
Why now, and how would this assist people to deal with the current crises we're seeing?
One of the things that strikes me right now is that many of our social programs out there are laboring under excess demands. They're barely coping. I am on the board of a community financial counseling services, and we're running through counselors. We're burning out our counselors because they're dealing with problems, and massive problems that they've never had to face before. That's true in my sector. It's true for food banks. It's true for every organization I can point to. We are reaching a crisis position. We have to make some decisions going forward. I am a bit of a historian, and I've been doing healthcare for a long time. And one of the things that really comes to mind over and over again when we talk about basic income are some of the battles that led up to the introduction of Medicare over the years. And I think sometimes that crisis gives you an opportunity to do better things, but I think we also need to be able to look beyond the next election cycle. This short-term perspective, this notion that times are tough right now, we'll just boot it forward and somebody can deal with it 5 years from now. The next regime can answer the questions. Things can happen over and over again. I think we have to bring a longer-term perspective and start asking about how our society would be different if we put in place a basic income today.
So I'd like you to talk a bit more about why you are advocating universality. And I know there are different ways to calibrate that, but why don't we just do a more targeted approach? Find the people in the downtown east side, all of them, and give them the cash transfer, but don't give it to anyone else.
It's not an efficient way of dealing with things. The more targeted programs you introduce, the more gaps you introduce into the system. The more gaps there are, the more opportunities there are for people to slide through, to not quite fit. Basic income is a more universal approach, so everybody can get access to at least some supports. So I think that's one answer. I am an economist, and I understand the criticism. The idea, I think, if you're dealing with a small problem, a targeted approach is appropriate. I think we're not dealing with a small problem. We're dealing with a lot of interrelated problems, and I think that targeted approaches simply don't work under that kind of a setting. I think we need something bigger than that. We need better ways of integrating what we have out there.
And Dr. Forget, you mentioned that guaranteed basic livable income will increase hours worked and not disincentivize work. And I would welcome additional insight on those comments and conclusive findings on what you may have on that, and comments from other panelists are welcome on those findings or conclusions.
Yeah, that's a really good question. The whole work disincentive issue, my opinion is that a basic income has very little impact on the amount of hours worked. I believe that that's going to be the finding. There was a question about Finland, the Finnish experiment, a little while ago. They began that experiment with the hypothesis that people who received a basic income would work more hours than people who didn't receive a basic income. They didn't find that. They found absolutely no difference between the control group and the subjects. I talked to the director of that program, Ollie Kangas, and he told me something very interesting, though. Towards the end of the project, he did find a difference, not in terms of the number of hours worked, but in terms of the kinds of jobs that the subjects found relative to the to the control group. The control group, to the extent that they were still working the sort of temporary, handing out leaflets kind of jobs that they'd been working before the project came along. What happened to the subjects is that some of them were moving into real jobs, jobs that continued over time and that they would expect to see improve their lives. That didn't show up statistically, partly because the project wasn't long enough to see it. So I'd like to see those kinds of long-term impacts. I don't know if that's going to happen. I don't believe that there's any evidence at all that a basic income either incentivizes or disincentivizes work. I don't think you're going to see a huge difference between the two. If you introduce a basic income, people aren't going to flee the job market. They haven't in any of the experiments we've put in place. They haven't when we've introduced basic income-like programs. When we introduced the Canada Child Benefit, mothers worked more, not less. So I just don't think that there's going to be a huge difference out there. What I meant to say when I was presenting was that some people seem to think it was going to increase labor market participation. Some people seem to think it's going to reduce it. I don't think there's any difference, and I don't think there's any evidence to support the notion that it's going to create much of a difference. I think the PBO was quite correct to use as a first estimate a 1.5% reduction in the number of hours worked when they did their report. That's a very, very small amount. It's an appropriate choice to make.